Welcome to the Bridging Insider. I'm Kara, and it's great to have you here. This week we are doing something different. It's an interview, but we'll be showing you a little bit. And this is Kathy, who is here. She's had a few things going on lately. You want to share a little bit with what you've been dealing with?
Well, we started doing some of this work when I had you noticed I had a little bit of lymphedema several months ago, or 3 months ago. I didn't even notice it, and you said, I see your arm is a little swollen. Mm-hmm. And then it stayed like that, and then I had a biopsy. Yeah. And after the biopsy, the lymphedema got very bad. And the biopsy was a terrible experience, and you helped me come back from that. And I'm still recovering from that, but you helped me with that, and you've been helping me find a way to take care of myself with the lymphedema.
Okay. So Kathy is, my guess, is going through some cancer diagnosis and treatment. Mm-hmm. And one of the things with bridging that we talk through in other ways with what I've been showing you is how we support. And sometimes it's supporting during the process so that you can get to the other side better, or just manage on a day-to-day basis better. And the injury isn't from the bike accident or the car accident. It's from the medical trauma. So that's the biopsy, and that's over here.
It's right here.
She also has what's called a port, referred to as a port. That's right here, mm-hmm. which is where they use that to access for both chemo and blood draws, or, well, they could. That's a whole nother story. So for medical purposes. And each of those, it creates its own ongoing issue. And so one of the things we wanted to share with you today is just a little bit more about that. And also, I've taught you a few things so mm-hmm. that I'd love to see Kathy every day, and she'd probably love to see me, but we have lives. And it's like, what can she do on a daily basis to help? What are some tools?
And also, how you helped me initially when I had such a traumatic biopsy, mm-hmm. where I had no anesthesia, and it was extremely painful. And you helped me, first of all, even recognize and help me remember how the impact really did affect me, and the approach the gentle approach helped me be more gentle.
So with bridging, one of the ways that we'll describe is we're supporting and guiding and then resetting the muscles. And Kathy actually had a great reframe of that for her situation was, just soothe and calm, mm-hmm. and then guide and reset. Mm-hmm. So I'm just going to walk around, and we'll still talk through, but you can just watch just some of the things that we had to go through, and I'll talk through that a little bit. But any medical trauma, one thing I think I also noticed, were you breathing very well at different points in time? No.
Well, I didn't even notice that I wasn't.
And I was like,
and
wait,
you noticed, right, how tense and...
So mm-hmm. she had this procedure over here, and so again, it's soft, it's squishy, and it's just holding, and you don't really feel, describe what you feel.
Just a gentle presence.
Yeah, but if I use my hand, it's a little harder.
It's much harder.
Yeah, and so it's like if this has been traumatized, I just really want to calm it down and let it know things are going to be okay. And I'm holding on the back side just to provide some support from front to back, because it's her whole shoulder. And it's just, I can just feel like it's melting away. Mm-hmm. Can you feel it melting away too?
Not yet.
Not yet.
I was just still thinking about that. I never forgot when you first approached me after the biopsy. You took a moment and just took me in with the whole thing. You just slowed everything down, and just being with it and with this, and there's such a gentle approach.
So often what I find with people who've gone through or going through different medical things is we just want to like hurry up and take care of things. And it's like sometimes we just need a minute. And so just to take that minute and find how to breathe again.
And noticing that I wasn't breathing and just trying to get an assessment, a felt assessment.
Yeah. And her shoulder there, it's just kind of rocking around a little bit. So what we came up with to help her find her own way of breathing was we had to come up with little names to make it a little fun but easy to remember. It was so if we got it to soothe and calm. She just picked up this peanut like holding a baby, and because of where the different traumas are, just holding the baby actually provides some support, very gentle support. But also, we came up with just the right way to rock the baby. And if any of you have had babies that you need to hold, you know it's a process. Are you bouncing them up and down, a little sideways, a little turning? And it's like you just have to come up with one, where does it feel comfortable to hold the baby? And then what's the right rocking for it? And you've been doing this on your own now, right? So like a couple of weeks?
It's been like a week and a half.
Yeah, so it's been a little while.
A couple weeks.
And what do you find as you do this for yourself?
Well, first of all, I'm tending to myself, and I'm the whole nervous system is shifting. It's like holding a baby. So it's not just holding this baby; it's a way of holding myself. And so
it's kind of like giving yourself a hug.
Yes. Yes. Yes.
And so one question we often get asked is, can you do bridging to yourself? And in reality, there's a partly yes, partly no. A lot of the resets for the muscles are the same reaction to your nervous system as tickling, and you can't tickle yourself. However, when you're using the peanut, and it's like the third party that is kind of helps with calming and guiding, and then depending on how you're reacting with the surface itself, that can affect the reset. So if you're using your own hands, you wouldn't be able to, but by using the third party, you're able to get some really subtle resets yourself. Okay. Oh, it will just look so calm.
And then we switched it sometimes too, because this really helped my port.
Ah, yes.
Which would get sore and kind of irritated because where it is, like with seatbelts.
Seatbelts from driving, yeah.
They don't think about that when they put it in. No. And so just switching it this way too gets the biopsy, and it's just gentle and soothing and feels like it's calming the whole area down.
Yeah. And then when you work, you're sitting often, and so this peanut has become you've been using it for support, haven't you?
Sometimes it's hard to do this in work.
Okay.
So mostly if it's in between.
In between, okay.
So or when I'm on Zoom, and I can do this.
So again, it's a support, but it's also affecting some change. And then,
well, right, this feels like it's helping the flow.
Right, and just for those of you wondering, she does have a, it's a lymphatic sleeve. And so it's wrapped so that it helps the fluid to not build up. It's got a spiral shape to it that helps. But just all that little movement kind of adds some like a little rocking to get that get the fluid moving. So, and then with this one, we found that it was nice because the port actually put some tension on her neck. It was just sort of a nice neck support.
We called this one Cradle the Phone.
Yeah, so we did a lot of cradling and rocking. But again, so for those of you, just a different perspective on bridging of just really more in the support. So whether it's calming and supporting and guiding, but just to help while you've got things that are not going to change, it just helps you deal with your day and get through your day in a more comfortable way. so that they don't build up and cause more. Anything else you want to add to that?
There's some kind of gentle attention for self that using these third parties, as you call them,
Yes.
my third party peanuts, that is feels like I'm doing something to help myself, and even if it's very subtle, but it's very full of care.
Nice.
Mm-hmm.
Great. So again, this is a very different example, but we really felt it was important, and Kathy was able to be here to help show and discuss and share.
Oh, can I talk about what you did with my shoulder? Remember how I was sitting before when I first had this, and I was kind of contorted, right?
Oh, she was pulled sideways,
Mm-hmm.
and we had a picture of her with her arm up, and she didn't even realize she was like kind of all scrunched over, and then later it was like, relax, like your shoulder could breathe.
Right. I didn't even realize how I was holding myself. Yeah.
So sometimes we don't realize like where we're storing that tension, but just adding a little support and a little bit of movement allows us to let that tension find its way away. Yes. So again, love to share examples of how micromovements can get reset in a variety of ways. And this is a much more personal and very deep way. And so please give us a thumbs up for Kathy for being here. And for other examples, again, of how trauma and disturbance to the body affects your day and how bridging is able to get you back on track, subscribe to the channel. For those of you who are in the Chicago area and would like some help, that we're north of the city, come on up. And for those of you who are not here, we can do a virtual consult and guide you for how to use some peanut balls to help your situation. So thanks for being here, and thank you for being here.
Thank you for being here.
Sharing all the way that you're doing. So thanks.
Thank you.